VitalPoint Home consists of two systems. One is the VitalPoint monitor that will be at the patient's home, and the other one is the Remote Device Connectivity Software, or RDC, which will be used by the clinician remotely using a Windows-based computer. The first part of this video will demonstrate the functionality of the monitor used by patients in their home. The monitor boasts very high compliance due to its user-friendliness and its ability to connect from anywhere with ease. The four ways in which the VitalPoint can send data to the HIPAA-compliant servers are: 1. Through a regular analog phone line, using the provided telephone cable. 2. Through the Internet, using an Ethernet adapter. 3. Through the Internet, using a Wi-Fi secure bridge. And 4. Through a cellular modem. A unique feature about the system is the fact that there is never an IP address or phone number that needs to be entered into the monitor, regardless of where it is used. It automatically knows where and how to connect, whether it is using a phone line, the wired or wireless Ethernet, or through the cellular network. To power on the VitalPoint monitor, simply turn on the switch on the back of the monitor. The logo on the main startup screen can be changed to the logo of the facility acquiring the product for branding purposes. When the monitor first comes on, it greets the patient and lets the patient know when their next scheduled activity will occur. There are three choices on the screen: take measurement, report symptoms, and setup. The patient can set the speaker volume by selecting the setup button on the screen. The patient will then pick a particular volume level, then click continue.
If you like this volume level, then please press the continue button.
Similarly, they will next be prompted to set the alert sound level. This alert sounds when a particular reminder or an activity has been scheduled for this patient. From this point forward, every screen on the monitor will be read to the patient at the chosen volume level until it is changed by the patient. From the main menu screen, the caregiver can access a hidden screen to select a language by clicking multiple times on the top right corner of the display. This opens a new screen where various languages can be selected, such as English, Spanish, or Portuguese. French, Italian, and German are additional language options. The language on the screen, as well as the voice prompts, will be in the selected language. Repeat these steps to select a different language.
Elija el problema que desea reportar: respiración, hinchazón, corazón, estómago o intestinos, orina, herida, dolor o general.
The patient can report a non-urgent symptom by selecting the Report Symptom button. This will take the patient to a new screen that provides them a list of various symptoms they can report. In the event of an emergency, the patient should call 911. For example, let's report symptoms regarding the heart. Depending on how the patient answers the questions of the questionnaire, the next question will vary automatically based on the previous answers. This continues until the tree of particular questions is completed based on the patient's responses. The questions were originally developed by VNAA nurses in order to gather an assessment of the patient's condition as if it were being reported in person. Once again, reporting symptoms is not a required step for the patient, but rather an option if the patient feels that they should report some discomfort to the caregiver. This data is then automatically sent to the caregiver through HIPAA-compliant servers, which can be accessed via a computer or a mobile device. If the patient has more symptoms to report, he or she can easily do so. When selecting the Take Measurements option, a new screen appears with the various measurements which the patient can choose to take. Please note that if a particular measurement was scheduled by a caregiver, the patient would not see all these selections, but instead would be taken directly to the instructional screen for that particular scheduled measurement. When blood pressure measurements are taken, additional instructions are available if needed. Either way, the system still takes the patient through the basic steps to take blood pressure. Note that the blood pressure measurement will be accurate even if the patient is experiencing irregular heartbeats. Once the patient clicks Take Measurement, the cuff will begin to inflate and take the blood pressure reading. Once the reading appears on the screen, the patient simply clicks Complete. If this measurement was not scheduled by the caregiver, the patient is asked whether additional or different measurements are needed. When done, the data is sent to the caregiver. Please note that 5 sizes of blood pressure cuffs are available, from pediatric to extra large. Another common choice is pulse oximetry, which provides oxygen level and pulse rate. 2 pulse oximeters are available, wired or wireless, using Bluetooth technology to communicate with the monitor. Temperature measurements are taken using the approved reusable temperature probe. If the patient uses a Johnson & Johnson One-Touch Ultra Glucose meter, it can be connected to the VitalPoint monitor, and the data from the meter will be automatically transmitted through the system. However, if the patient uses a different brand or model, he or she can simply enter the glucose reading from his or her meter manually. The wired version helps with patients who may not be trusted with entering the correct information due to dyslexia, vision impairment, or other issues. To enter prothrombin data, the patient can simply copy the information from the meter into the monitor. Fluid status is a very important measurement, especially for cardiac patients, and is one of the unique features of the VitalPoint monitor. It allows the caregiver to receive information regarding fluid buildup in the patient's chest remotely. The measurement is also sometimes referred to as a bioimpedance measurement. The measurement is easily performed non-invasively by placing a device similar to 2 ECG leads on the chest of the patient. One lead is placed below the breastbone and one at the bottom of the neck, as shown on a monitor graphic. The system offers 2 weight scale options, wired scale or wireless scale, that uses Bluetooth technology. The wireless scale allows patients to have the VitalPoint monitor and the scale in different rooms of the patient's home. Our electrocardiogram is a 5-lead ECG, which allows patients to easily place the leads in the proper location on their chest, thanks to color-coded and labeled electrodes and a clear diagram to ensure proper placement. The measurement has been shown to be easily performed by patients alone at home while providing very good data. The system is intelligent enough to detect if one or more of the leads are placed incorrectly and will provide the patient with an error message. In this example, the patient has scheduled an activity in 2 minutes. When the time comes, the system will take the patient directly to the screen relevant to that scheduled activity. By clicking on Begin Activity, the system displays which activity needs to be performed by the patient. In this case, this is for medication compliance. It is reminding the patient to take a particular medication and asking whether or not this medication was taken. If the patient selects yes, the information will be reported to the caregiver. If the patient selects no, the system will ask for a reason before notifying the caregiver. In this example, we did not connect the monitor to demonstrate what the monitor does when it is not able to successfully communicate with the server, and emphasize that the information entered by the patient has not been lost. It will be stored on the monitor until the next session in which the patient successfully connects to the servers and reach the caregiver. Once completed, the patient will receive a confirmation message on the monitor stating that it has successfully communicated with the central server. The caregiver can, through the RDC software on his or her Windows-based computer, send instructions or other messages to the patients, and can even ask the patient custom questions. In this example, a custom question was sent to the patient via the monitor, and all the patient has to do is answer the question by pressing the button that best answers the question. See the short remote connectivity software video for more information on how to generate such instructions or question-answer sets from the caregiver's computer. Another activity alert the patient could receive, and the most commonly used activity alert, is for the patient to take a measurement. As mentioned earlier, the patient will be taken directly to the particular measurement screen. The Remote Device Connectivity, or RDC software, allows for customizable communication between patients and their caregiver and is included with every monitor. RDC is a complete electronic medical record system that is used by clinicians to monitor and manage an unlimited number of patients. The Remote Device Connectivity software allows a caregiver or family member to access the patient's vital signs data from a Windows-based computer from anywhere. This is not data that is typically accessed by the patient. All they need to do is click the RDC icon on a computer desktop, which will bring them to a login screen. To access the RDC data, the user enters a user ID and a PIN number on the login screen. Once logged in, the software will access CJPS's HIPAA-compliant server. By clicking the Configure button, a new window will appear to allow the caregiver to set up the agency information. The first tab has General Settings, and the Agency tab has the name of the main agency. To add an agency location, which does not have to be a physical location, but could be a virtual location such as cardiologists or family members, simply click the Add button at the bottom of the window and fill out in the required fields. If there are many locations, they can be found easily by clicking the first letter of that location. The next tab is the People tab. This is where individuals that are allowed to view certain patients' data are entered. To add a staff member or a patient's family member as a user, simply click the Add button at the bottom of the window. Then fill out the various fields for that individual. The email, mobile phone, and mobile carrier fields are used for users who would like to receive alerts on their mobile device, as alerts occur without having to log in to the RDC. These users can be assigned to specific locations previously defined. There are 3 levels of access: user, manager, and administrator level. A simple user has limited access rights and can mostly only view the data of their assigned patients, but cannot make any changes. An administrator has the ability to make any changes that he or she wishes to make. A manager is typically a case manager who is not allowed to add or remove patients or access patient data, but can make some changes such as set up or modify monitor settings for alerts or send questions or instructions to the patient via the monitor. The ID tab allows for the optional storage of caregiver licensure. The last tab in the configuration screen is the Devices tab. This lists all the devices that are currently owned or leased by the agency. This is where a particular monitor can be set up for single patient use or multiple patient use by simply clicking a box. The single patient mode is typically used for monitoring chronically ill patients or when a monitor is sent home with a patient to help reduce hospital readmissions. The multi-patient mode is typically when the monitor is used in a home where multiple individuals share a monitor, such as spouses, or when used as a kiosk in shared facilities, such as doctor offices or retirement communities, or in a case of a nurse visiting patients and carrying with him or her a monitor to use when taking measurements in the patient's home. To add a device to the list, simply click the Add button at the bottom of the window. To view patient data, select the patient's name. A brief summary of that patient's information will appear above the patient list. In this example, by selecting the patient Stella Wilson, the highlights of the patient are listed in the window. It is easy to add or delete a patient. Note that if a patient is deleted from the list, his or her information is only removed from the list, but the data will remain on the server and therefore never lost. Editing a patient's record is simple and can be done by clicking the Edit Patient button. This opens the patient information window. Here the user can enter or have the system create a medical record number, the name, address, social security number, and date of birth associated with that patient. There are also various other fields such as phone number, email address, demographics information, primary care physician information, and emergency contact information. To add a new patient, simply click on New Patient. The Care Providers tab is an important set of information. This is where users of the systems entered earlier in the Configure menu are assigned the patients they are allowed to access. By selecting the box on the right-hand side, the user can view that particular patient's data. There are no limits to how many users can access a particular patient's data. For example, a physician, a nurse, a specialist, and a family member could have simultaneous access to the patient. Clinicians' certifications can be entered if required. The new Encounter button is for setting appointments, if the user wishes to use the RDCs to set up such appointments. Here, the user can select the type of appointment or customize appointment types by clicking the Add button. Under the skill type and for the reason for visit drop-down menus, there are various choices, which can similarly be customized to the user needs. These appointments can easily be deleted or edited from the patient list window. The Upload button allows the user to attach additional electronic patient information in any format. These electronic files could be images, x-rays, videos, or scanned prescriptions. The Clinical Data tab is the heart of the RDC software. The user can select a time period to look at patient data, for example, to compare how the patient fares under various medication regimens. The default view covers the last 2 weeks. In this example, let's look at a year's worth of data from April 1st, 2011 through April 12, 2012. The system downloads the data from the HIPAA-compliant servers and may take a moment depending upon communication speed. Each row corresponds to a particular measurement or other information exchange. Each column corresponds to the day and time the data was sent from the monitor. Some of the cells are red. This allows the user to quickly identify which information is abnormal. For example, in this case, the patient took her blood oxygen level on this date, and the results were first an error, then 96% oxygen level, and then 97%. To see what caused the error, the user can either hover over the red cell and see the error message in the window pane below the data grid, or click on the cell. In this case, the error shows the sensor was placed incorrectly by the patient. To move to a different date, simply slide the cursor to the right or to the left. In this example, the reason some of the numbers are highlighted is because some of the readings are outside the parameter range that was set by the clinician for this particular patient. Here, the pulse oximeter reading of 86% being too low for this patient. Thus, the value is highlighted in red. Other warnings include any and all symptoms that were reported on the VitalPoint monitor by the patient. These symptom reports are always highlighted as the patient felt it was information they wanted their caregiver to notice. To read the symptom report information, the user can either hover over the red cell and see the error message in the window pane below the data grid, or click on the cell. The responses listed are the patient's answers to a series of questions that were asked by the monitor if the patient elected to report such symptoms. To view a patient-generated electrocardiogram, or ECG, the user clicks on that cell and a new window will open with the ECG waveforms. Each can be zoomed in and auto-scaled. The data can be saved, emailed, or printed. In case of a warning, the clinician can click on a specific warning message to view it, and then can enter clinical comments and sign off on the warning. The sign-off will automatically provide the author's name and time and date of the sign-off. Another feature of the RDC software is its medication compliance capability. This shows in green the drugs the patient is currently on, and in gray the drugs the patient used to be on. To add a medication, the user will simply select the Add button. The name of the medication, dosage, and frequency information can be entered manually. Alternatively, the user can search for it through the up-to-date RDC database. Medications can be searched by name or by class. In this example, if an anticoagulant is sought, the system will list the various families and specific drug. Then by selecting OK, the particular drug will be moved to the patient prescription window, and selecting a dosage level from the list will automatically populate fields which can be overridden by the user as needed. The system also looks for drug interaction or patient allergies and will warn the clinician if any potential drug interaction or allergy issue exists with that newly prescribed drug. This drug database is automatically updated monthly by the system. In order to send medication reminders to the VitalPoint monitors, the user simply selects, edits, and chooses the time of day the reminder should occur. In this case, 9 a.m. is chosen. In this manner, the system will send an alert to the patient reminding them to take the medication every day at 9 a.m. If in addition the caregiver wishes to receive a text message to know whether or not the patient has been compliant in taking their medication, the user can check the box to receive an SMS text on their cell phone. The patient will be asked at these times whether they have taken their medication. If he or she answers no on the VitalPoint screen, then a reason will be requested from out of medication, unable to take the medication, or unwilling to take the medication. The caregiver will be notified of the answer provided. The Notes section allows the user to organize his or her notes in different categories such as ICU notes, SOAP notes, discharge notes, field notes, etc. Reports can be generated very easily by clicking the Add button in Reports. The user will select the time period of the report along with the type of content to be included. In this example, medication, monitor data, and clinical data, and then choose the report format, Microsoft Word or Excel, to allow for easy access by other parties that may not have the RDC software. This section of the RDC software allows the user to interact with the device the patient is using in his or her home. The user will select the patient's monitor and click on the Settings button, which will open up a new window. The first two tabs allow the user to set minimum and maximum values for each parameter of interest for this particular patient. Pulse rate, blood pressure, and temperature settings are on the first tab, and pulse oximetry, weight, blood glucose, ProTime, and fluid status are on the second tab. For each of those parameters, if the patient's measurement falls outside the set range, the data will be highlighted in red in the RDC software clinical data grid, and if, in addition, the clinician selected to be paged about such an event, by clicking the Send Text Message to Mobile Phone, a text message or email will be sent to that clinician. If the clinician had not clicked this box, the user will still get the information highlighted on the RDC software, but will not receive a text or email message. To schedule a particular measurement to be taken by the patient, the user clicks the Edit button for the particular measurement and then selects the time of day. In this example, 11 a.m. is selected for a blood pressure measurement. Now, every day at 11 o'clock, the monitor will alert the patient to take his or her blood pressure. If the text message button is also clicked, then the caregiver will receive a message if the data is outside the range, or if the measurement is not taken within 30 minutes of the scheduled time. If a caregiver wishes to be paged when this patient self-reports a symptom, this box needs to be checked. In case the patient is at the hospital, traveling, or away from the monitor for any reason, the communication between the RDC software and the VitalPoint can be disabled by clicking the Disable Monitor button. This will allow the user to keep all the settings while the patient is not using the monitor, and temporarily preventing any alerts to the monitor or to the RDC software. A time zone can also be set if the patient is in a different time zone or is traveling with a monitor to a different time zone to ensure that the alerts are sent and recorded at the correct time. The last tab allows the caregiver to send the patient specific instructions or questions, which will appear on the VitalPoint monitor. If the instructions need to be reported daily, a time of day needs to be chosen. In this example, 7 a.m. Custom questions can be entered by the caregiver, along with up to 3 answers to reduce confusion by the patient. The monitor will display the question at the top of the screen and provide the 3 answer choices as buttons on the touch screen that patients can easily press. For example, please select a time for me to visit for your infusion. Possible answers could be tomorrow at 2 p.m., Thursday at 4 p.m., or Friday at 10 a.m. Such questions may be set as daily recurrence as well if needed. The RDC software can be integrated with other EMR systems such as Cerner, Epic, McKesson, Delta, Vista, or others using HL7 standards. We hope that this introduction to VitalPoint was helpful. We look forward to discussing implementation. Please contact us at 1-248-593-1264 or cjps-info@cjps.com or visit us on the web at www.h2oconnectivity.com.